The evaluation of the Neighbourhood nursing pilot. The Neighbourhood nursing pilots. The Neighbourhood District nursing pilots have been funded by Welsh Government in 3 locations in Wales: Cwm Taf Morgannwg University Health Board, Aneurin Bevan University Health Board, and Powys Teaching Health Board. These different locations reflect the urban valleys and rural settings of Wales. The health boards are experienced in delivering integrated services with local differences to meet the local population needs. The Birdsog Model. The neighbourhood nursing pilots are based on the Dutch Birdsog Neighbourhood Care Model. Birdsog is a not-for-profit health organisation with an ethos of humanity over bureaucracy. It has been described as a whole-system healing approach to promoting health and well-being of people, their families and their communities. The Birdsog ethos reflects the King's Fund 3 characteristics of good care: caring for the whole person, continuity of care, and personal manner of staff. The purpose of the neighbourhood nursing pilots is to deliver a nurse-led, person-centred, coordinated and prevention-focused nursing service to the local community. The pilots have translated and incorporated aspects of the Birdsog model that include holistic assessment, mapping networks of informal care, finding ways to involve carers, offering integrated care delivery, extensive use of IT systems, promoting self-care and independence using an empowerment model, supporting clients in their own social environment. This should lead to increased client satisfaction, increased staff satisfaction, and efficient use of resources. The evaluation team. The evaluation is being conducted by the members of the Prime Centre Wales and the University of South Wales. Prime Centre Wales is a research centre focusing on primary and emergency care, funded by Health and Care Research Wales in order to develop and coordinate research proposals and support researchers. The Wales Centre for Primary and Emergency Care Research, Prime Centre Wales, aims to improve health and well-being through undertaking high-quality research on topics of national policy priority in primary and emergency care and ensuring that findings are translated into policy and practice. It is an all-Wales centre co-led by Cardiff University, Bangor University, the University of South Wales and Swansea University. The academics leading on the neighbourhood nursing project are Professor Carolyn Wallace, Dr. Sarah Wallace, Professor Mark Llewellyn, Professor Joyce Kenkra, Dr. Siva Ganesh, Professor David Pontin and Dr. Sean Tetlow. The evaluation domains. The study uses a realist evaluation methodology given the strategic, policy and practice context of the neighbourhood nursing pilots and the question posed by the invitation tender. A realist evaluation will include impact analysis using quantitative and qualitative data. It will answer these 2 main questions, whilst considering what has worked well, what has not worked so well, and what were the main challenges and how far have these been overcome. The purpose is to understand the mechanisms of change and provide a robust evidence base to transfer the principles across Wales. A realist evaluation allows us to consider differences in context and mechanisms across the 3 pilots which influence outcomes and identify which aspects are transferable or not. The evaluation methods. We originally proposed a mixed methods approach using validated questionnaires, online surveys, interviews, focus groups, document analysis, observation and reflective diaries to build a robust evidence base to judge the impact of the pilots for individuals, teams and their organisations. Unfortunately, due to COVID-19 imposed delays and restrictions on permissions, we were unable to deliver the original plan. Alternatively, we are conducting a retrospective study using service data, patient outcomes, satisfaction surveys and qualitative interviews with staff and stakeholders. A rigorous review of the published literature to provide an evidence base to compare the study findings against will be completed. The original intention to gather patient individual time series data continues to be elusive. Evaluation phases. Phase 1. Project management, communication and meetings, literature review and desktop data analysis, April to September 2020. This is a very important stage of the evaluation. We have worked together during a difficult time to redesign the evaluation, making sure that the right decisions are taken with everyone's consent. Phase 2, evaluation phases. The impact evaluation. We will explore whether the pilots have made a difference to people using the neighbourhood nursing pilots and their stakeholders. Service level data and clinical level data will be accessed, collected from all pilots participating in the evaluation and analysed. This addresses the pre-implementation and early transitional phases of the pilots and proceeds across time and into the outcome phase. This includes the outcome measures identified within the neighbourhood nursing business case. We have agreed a data set for each health board, understanding that each health board has a unique contribution to give to the understanding of neighbourhood nursing. The data from the 3 pilot sites will give us an understanding of contextual influences on mechanisms, impact and outcomes. Qualitative interviews, focus groups with staff and stakeholders, and documentation will help us understand their experience perspective of the impact of the programme. The qualitative research will elicit data on the outcomes of the intervention and the process experienced by stakeholders. Due to COVID-19 restrictions, we cannot interview the patients at present. The data will be analysed using a realist approach by pilot site initially to generate 3 case studies, after which a high-level analysis of the 3 pilot sites will identify which aspects of the neighbourhood nursing model may be transferable across Wales. Phase 3. The final meetings and reporting. We are very aware of the need to report on all the key aspects of the study. We believe the reports have 2 main functions. Firstly, they present a thorough analysis of the issues under study. Secondly, they can be a valuable resource to move an agenda forward with suggestions for improvement rooted in evidence. The issues surrounding neighbourhood nursing are complex, but we will produce a report in a format accessible to all and a summary for wider circulation. This will be delivered at the end of October in 2020. The final report will detail all the data gathered and analysed as part of the evaluation. It will reflect on what works in these pilots, where, why, for whom and to what extent. Our iterative methodological approach will ensure a nuanced understanding of the relevant issues and the prevailing culture, which is so important for changes to follow.